There are a lot of questions regarding COVID-19, especially in children. So today I'll be addressing some of them. Hello everyone, this is Dr. Sunanda Agastya and welcome to my channel.
And children also get COVID-19?
Yes, definitely. In first wave of COVID-19, we could see very few kids getting affected, whereas in second phase of COVID, the number of cases are increasing, especially in kids and also in younger adults. So it is our responsibility, being elders, we should take care of the kids properly.
Doctor, how severe is it, do you think, in children compared to adults?
Higher number of complications are seen in the age group of 1 to 1.5, and fortunately 2 years to 12 years, this age group of kids present with mild symptoms like cold, cough and mild fever, whereas kids older than that, they present with symptoms same as adults.
What are COVID-19 symptoms in children?
About 60 to 65% of children are asymptomatic, whereas the rest of them present with mild symptoms like fever, body pains, headache, cold and cough. Whereas some of them present with symptoms like adults. And in this new variant of COVID, children have symptoms like abdominal pain, diarrhea, vomiting and not cough and cold.
When should the parents take the child to a hospital and what are the warning signs for the same?
Okay. If the child is having fever for more than 4 to 5 days and if the temperature is around 101 to 103 degree Fahrenheit and if he is dull and lethargic than usual and if he is complaining of abdominal pain, vomiting and if the saturation levels comes down less than 92 and if he is breathing with difficulty or if his breathing is faster, you have to take him to the nearby hospital.
What are the ways to test COVID-19 in children?
So the standard procedure or diagnostic method is RT-PCR. I know it's troublesome in children, but this is the only way we could find for now.
What to do if the child is tested positive for COVID-19?
The first thing I would like to tell the parents is do not panic because 99% of kids recover easily and they have very mild symptoms or even asymptomatic. Okay, so the second thing is isolate the child. So one parent, either mom or dad, has to be the primary caregiver for the child. That means you have to take all the mandatory precautions like washing your hands frequently, wearing mask, wearing face shield, and if possible, wear a PPE kit. And also maintain some distance from the kid. I know it's painful not to hug your child or not to kiss your child, but only if you're safe, you can take care of your child. So please avoid touching your child frequently. In case if the child is tested negative and if parent is positive, please do not send them to any relative's house or grandparents because as we have the tendency to send them away or keep them safe, right? So by the time you get tested positive, they might also carry the infection and when they go to relative's house or grandparents' house, they tend to hug the grandparents and thus the infection spreads to grandparents and due to their age, there will be some more complications added to it.
What are the prescribed medications in children with COVID-19?
As of now, there is no specific treatment for children with COVID-19. So only in case of fever, paracetamol is given. Other than that, multivitamins are given and a balanced diet to be given and encourage the child to drink adequate amount of water. Keep them in well ventilated area and the room should be cool because once the temperature is warm, it will again lead to dehydration and encourage him to sleep for at least 8 to 9 hours.
Are there any specific pulseoximeters for children?
So there are no specific kind of pulse oximeter for the children. So what we use for adults, the same thing has to be used. Make sure you use the child's longest finger and insert it below the red light in the pulse oximeter and do not panic with the first reading. Take at least 3 to 4 readings and consider the average of it. And also it takes 30 seconds to 1 minute for the readings to be accurate. And you can also observe your child's breathing pattern. If the child is breathing very rapidly or if there is any difficulty in breathing. So all you have to do is place your palm on the child's tummy, and this has to be done only in absence of fever and when the child is sleeping, because the breathing rate will be high in case of fever and when he moves around. Okay, place your hand on your child's tummy and measure how many times your hand is raising in a minute. So that is the breathing count for 1 minute. So for newborn to 2 months of age, 60 breaths per minute is considered to be normal, and 2 months to 1 year, 50 per minute is considered to be normal, and 1 year to 5 years, 40 breaths per minute is considered to be normal. So for 5 years and above, 30 breaths per minute is considered to be normal. In case of high fever, give the child cold sponge.
Are there any tips in increasing the oxygen saturation?
Yes. So you might have heard about proning or prone position. So all you have to do is lie the child on his tummy. This is going to help him breathe better and saturation will be improved. And you can also encourage him to sleep on his side.
Now that we have covered all the medications and procedures for a COVID infected child, what are the preventions for children?
To the precautions, it's same for the adults and kids. The first thing is wearing a mask and washing hands frequently, and maintaining social distancing and avoiding gatherings like crowded places and all that. Okay, so we see a lot of adults wearing masks below the nose, right? And it looks so funny that even your child starts learning it. So once you wear your mask properly, even child develops the habit of wearing the mask properly. Make sure you select a correctly fitting mask. It should be proper in size and it should be comfortable, it should be soft, and it should be washable. And there are masks with valve that is not going to do any good in COVID-19. So do avoid such kind of masks. So when you select a mask, make sure it has got at least 2 layers, because a single layer mask or a cloth mask is not going to help. Okay, so you might have heard about double masking. So first wear a surgical mask or make your child to wear a surgical mask. On top of it, you can wear a cotton mask or cloth mask.
Thank you, doctor, for answering all of these questions. I'm sure this is not the end of it, but these are the questions that we could come up with right now.
Okay, you're welcome. Stay safe. So I think we have covered most of the frequently asked questions or the common questions which are in your mind. I would like to tell one thing for all the parents. So this is a time where all of us are facing difficulty or getting into depression or the commotion around us. So it's the same with your child too. Imagine telling your child not to go out, not to go to school, not to play, not to hug their grandparents, and so many restrictions. They start getting confused what is happening around. So make sure you give them best time and make use of this time to bond better with them and start to paint with them or color with them or read stories for them. Or you can also do mild exercises, that is again indoor exercise or yoga and fun activities, and ensure you avoid outdoor spaces. So this is all about the video for today. I hope you guys have got some of the answers. If you have more questions, you can comment in the comment section, or you can also message me through Instagram or Facebook. And if you like this video, do give a thumbs up and do not forget to subscribe to my channel and share this information with all your friends and hit the bell icon for further notifications. And I'll meet you up with another interesting video. Until then, stay safe, stay home, stay hydrated. Take care and bye-bye.